sometimes aspiration pneumonia that can be life-threatening. So whenever somebody identifies a person who is having all those symptoms of stroke, the first thing is to reach the nearby hospital as soon as possible, because there is something called a window period during which, if it's an ischemic stroke and if it's proper care is given, a good number of patients improve to a good extent. Once the patient is received in a hospital, depending upon his or her condition, the patient is stabilized. The emergency department takes care of this and makes sure that the patient doesn't aspirate, they don't have these seizures, anything is there, they take care of that thing. Once the patient is stabilized, they are sent for neuroimaging, that is generally a CT scan of the brain. Depending upon the finding of the neuroimaging, that can be either a ischemic or a hemorrhagic stroke, the doctor decides to go for either a conservative management and surgical management. Important about conservative management is that if people who have a ischemic stroke and who reach the hospital within a window period, that is 4.5 hours, it's possible to give them thrombolytic agents that will try to dissolve the clots in the brain cartilage. Generally, in layman terms, we call them as clot busters. If the patient has severe edema or a big hemorrhage, then they might have to go for a decompression surgery depending upon the midline shift or the pressure on the brain. Sometimes people might, because of stroke, might have a hydrocephalus. In those patients, they might be put on a ventricular drain to reduce the intracranial pressure. Once the patient is clinically stable after the acute stage management in a hospital, then the patient is assessed, and when it seems to be appropriate for the patient to be shifted to a rehab facility, the patients are shifted to a rehab facility. Now, when we receive a patient in a rehab facility, each and every patient should undergo an assessment. Now, there are different scales for various modalities to be assessed. And these are you can see on the scales on the screen, these are the general scales on which a patient who comes to our facility are generally assessed. This one is the MMSE, or mini mental state of examination, for overall mental function. This will give us an idea about the higher mental function of a patient, and that has some prognostic value on the outcome. Western aphasia battery is used for aphasic patients. MRC scale for strength, or medical research counseling for strength scale for strength, is used to measure the strength in the muscles of the patient's affected side. Then we have the modified Ashworth scale that is used to assess the severity of the spasticity in the group of muscles. Then we have a Berg balance scales for people who are able to stand, and for whom there is a stroke in the posterior circulation, balance might get affected. They might have ataxia. For those people, we generally use the Berg balance scale. And then we have a functional independence measure scale. Now, functional independence measure scale is a functional scale that will give us an idea about how dependent or independent is the patient in performing his or her daily activities. Nowadays, along with the FIM scale, we use a FIM-FAM scale. So in the same scale, both the functional capabilities and the mental status of the patients are assessed. Now, whenever we speak about stroke, there are stroke or stroke rehabilitation. Rehabilitation has three main goals. First of all, prevention and treatment of complications that might arise because of the disease the patient has. Then second is the management of pre-existing comorbidities. And the third is treatment of the issues or deficits because of stroke. Now, I have mentioned stroke here, but we should always keep in mind that rehab includes these 3 points in rehabilitation of whatever disease we are speaking of. So when we speak about stroke rehabilitation, we have to prevent the complications that might arise because of the stroke or bedridden condition of the patient. Management of any pre-existing comorbidities. We know that hypertension, hyperhomocystinemia, diabetes, obesity, all these are risk factors for patients who have stroke. So it's important to manage all these comorbidities, because an increased raised BP or a high or low sugar might again aggravate the condition. Then we have treatment of issues due to stroke. So we will